Eating disorders are serious mental and physical illnesses. They involve disturbed eating patterns and thoughts about food. But they are not simply about food. They are often a way of coping with difficult emotions. These disorders can affect anyone, regardless of age, gender, or background. These disorders can have severe consequences for physical and mental health. Early diagnosis and treatment are essential for preventing long-term complications. Signs of eating disorders can include dramatic weight loss or gain, preoccupation with food and body image, and social withdrawal. There are several types of eating disorders, each with unique characteristics. Anorexia nervosa involves a relentless pursuit of thinness and fear of gaining weight. Signs and symptoms include significantly low weight, fear of gaining weight, distorted body image, restricting food intake, excessive exercise, social withdrawal, amenorrhea, complications, malnutrition, dehydration, electrolyte imbalance, heart problems, bone loss, organ failure, death. Bulimia nervosa includes binge eating followed by purging, excessive exercise, or fasting. Signs and symptoms include binge eating episodes, purging behaviors like vomiting, laxative use, and excessive exercising, restricting food intake, dental problems, electrolyte imbalances, anxiety and depression. Physical complications include tooth decay from frequent exposure to stomach acid from vomiting erodes tooth enamel. Purging behaviors can lead to imbalances in minerals like potassium, sodium, and calcium, dehydration due to excessive vomiting and laxative use. Electrolyte imbalances can disrupt heart rhythm and lead to serious heart conditions. Dehydration and electrolyte imbalances can strain the kidneys. Frequent vomiting and laxative use can damage the esophagus, stomach, and intestines. Psychological complications include depression, anxiety, and increased risk of suicide. Binge eating disorder is marked by consuming large amounts of food quickly without compensatory behaviors. Signs and symptoms include eating large amounts of food in a short period of time, feeling out of control during eating episodes, eating rapidly, eating alone to avoid embarrassment, feeling guilty or ashamed after eating. Complications to binge eating are obesity, type 2 diabetes, heart disease, high blood pressure, sleep apnea. Avoidant/restrictive food intake disorder, or ARFID, is due to sensory sensitivities or fear of negative consequences. ARFID is characterized by a persistent failure to meet nutritional needs. Signs and symptoms include significant weight loss or failure to gain weight, lack of interest in eating, fear of choking or vomiting, sensory sensitivities to certain foods, restrictive eating patterns. Complications of ARFID are malnutrition, dehydration, growth delays, social isolation. Eating disorders are complex and often arise from a combination of factors. Genetic predisposition can play a role, making some individuals more vulnerable to developing an eating disorder. Certain genes may influence how the brain regulates appetite, mood, and body image. Psychological factors such as low self-esteem, perfectionism, and anxiety can also contribute to the development of eating disorders. These underlying psychological issues can make individuals more susceptible to negative body image and disordered eating patterns. Trauma and difficult life experiences can also increase the risk. Social and cultural influences can also play a significant role. The media's portrayal of idealized body types can create unrealistic expectations and contribute to body dissatisfaction. Societal pressures to be thin can also exacerbate these issues, particularly for young people. Family dynamics and interpersonal relationships can also influence the development of eating disorders. Families with a history of eating disorders, or those with overly critical or controlling environments, may inadvertently contribute to a child's vulnerability. Treatment typically involves a multidisciplinary approach, including therapy, nutritional counseling, and medical monitoring. The specific treatment plan will vary depending on the individual's needs and the type of eating disorder. Therapy plays a crucial role in addressing the underlying psychological issues that contribute to disordered eating. Cognitive behavioral therapy and family-based therapy are two common approaches used in the treatment of eating disorders. Nutritional counseling helps individuals establish a healthy relationship with food. Registered dietitians can provide guidance on developing balanced meal plans and addressing any nutritional deficiencies. They can also help individuals challenge distorted beliefs about food and weight. Medical monitoring is essential to address any physical health complications that may arise from an eating disorder. Regular checkups with a physician can help ensure that any medical issues are detected and treated promptly. For more educational videos, like and subscribe. For opportunities to earn continuing education credits or CEU, visit www.advancedpractice.io. Follow us on Instagram at Advanced Practice.